So this is basically how I go about explaining to a patient how we're going to fix their ingrown toenail. And typically I'll draw this on the back of the chart so we can refer to it. You know, sometimes we'll talk about it and then we'll come back to it and discuss it at a later point. So, for example, let's assume this is our nail. And this is the ingrown portion here that's digging into the flesh and has been causing them problems. So the first thing we discuss is the local anesthetic. First of all, we'll give 2 little injections right back down here at the base of the toe. And everybody asks, well, why are you doing it down here? The problem's up here. So the reason we do it down here is because it doesn't hurt. And once I do it, the entire toe goes completely numb. And again, I'll make sure it's completely numb before I do anything at all. So the nail itself doesn't finish here. It actually continues back a little bit onto the skin like that out of sight. So what we want to do is actually take away just a small portion of the nail in a straight line like that. So the first thing we do is very gently free it up. And I liken this to, remember as a kid when your mom used to peel an orange for you and she was able to take off the entire skin and do it perfectly, and then you'd have a go at it and there'd be juice flying everywhere and bits of white stuff left behind. Well, I'm kind of like your mom. Well, not really, but I can separate this very, very gently so I don't damage the tissue at all. Now, typically when we do this, there is 0 blood. So once we get back to here to the skin, sort of at the base of the nail here, we can actually work underneath and separate that off, and we can split that further back, remove that entire piece. So there's no cutting, no stitching, no mess, no fuss, no scarring. So once that piece is removed, it exposes a little group of cells down here from which the nail would regrow. So I can put a chemical down, destroy those cells so that they will never ever regrow again. So basically what you're left with afterwards is a lovely clean straight line. So you can cut the nail following the contour of the nail nice and naturally. You don't need to dig down the sides anymore. And basically the problem's solved. So again, just to recap, the reason we choose this procedure is that the more gently I can separate and remove that piece of nail that's digging into the flesh, the less damage there is to the surrounding tissue. So if faster it heals, less discomfort you'll feel, and subsequently afterwards when it's all healed up, no one should be able to know I've ever been in there at all.